So, Mr. Biggio,
Hello.
hi. Good. I'm just gonna go ahead and I just wanted to kind of give a recap from some of the stuff from last week. Whenever we ended, the last offer that we had given to you guys was a 4.25%. We left and I went ahead and I did a bargaining survey for the unit where we had lots of people that responded to the questions that I had on the bargaining survey. I wanted you to hear some of the concerns that are coming from the teachers from our unit. Teachers feel like the aid from Pinellas is because of the hard work that they have put in. Pinellas is a 3-time A. Everyone deserves to get something. People are super worried about healthcare, about the insurance. They're concerned that mixed with the deductibles and the premiums, that any raise that we get from Pinellas or from the state could actually wind up putting them backwards. And just like Pinellas needs to have a balanced budget, the teachers of Pinellas need to also be able to balance their budgets. Everything is going up. People have said that they are struggling to afford to live here. We have spoken before about like the numbers of non-renewals and things like that. If we can't do something about the cost, we're not gonna have to worry about non-renewals because people will wind up leaving because they can't afford it. And then we have also talked about the referendum. And one of the concerns that I heard repeatedly was that the referendum is coming from the voters. And that the teachers don't feel like that should be coming up on the sheet for the raise from the offer from Pinellas. So with that being said, I just want to make sure the referendum, am I correct in saying that the referendum is not subject to bargaining, correct?
Correct.
Okay. And I have some stuff that I printed for you guys that I want to go ahead and give to you. It is a sheet from our contract, actually, and it is a page that comes from Pinellas County Schools website. Well, actually, here, just pass it. So for my friends here in the back and my friends that are online, Article 49 of our contract, Part B says, the parties agreed to continue reviewing the salary schedule to reduce dependence on the referendum supplement over time. And then from the Pinellas County Schools website, it says the referendum retention income is separate from regular salary and benefit adjustments, which continue to be negotiated annually through collective bargaining, typically during summer budget finalization, which is of course where we're at right now. So with that being said, I know that the last offer was from me, so it's your turn.
Well, thank you for that information. I'm going to weigh in on each of the talking points you just raised. For those of you that I haven't met, thank you for coming in today. I hope you can hear me. And so thank you for being here. In all sincerity, it matters. It matters to you, it matters to us. And I believe it or not, we all want the same thing. And we have to understand that we're going to come from a place of peace and trying to do what we can to ensure the lowest rates for healthcare, highest salaries. But us like you, we all have to balance the budget. So thank you for your efforts, collective efforts, individual efforts as it relates to the 3-time A grade. I know how hard it is. I taught to, I understand it. And we appreciate the effort. And to your point, it only makes our district stronger. And it makes our ability to impact children and children's lives in the community so much better every single year when we know the kids are learning and getting learning gains coming up through the system. So, and all the sincerity from a human resources side, thank you. Because to be an exemplary teacher, as I'm sure each and every single one of you are, it takes an extraordinary effort. There's no question about that. the healthcare is and has been a continual concern. It's a concern for me. I started these sessions 4 weeks ago with a full head of black hair, and then this is easy. Trying to balance healthcare is something that's a little tricky, and I'm going to speak to that. I'll go back to that one in a minute, but I share your concerns, and it all goes to the same pot of money when you're self-insured. Your healthcare costs and your salary. We can raise healthcare costs and raise salary, or we can do one or the other. They're very dependent upon each other is the point. I know you recognize that, so I don't need to reiterate that. Affordability of living in Pinellas County, no question, it's an extremely affordable place. You can just look at the birth rates, number of kids and the families that live here, and how it shrink and shrink and shrink, and we understand that and feel it too. Referendum, to your point, is we're tracking right on it in terms of what we're doing. It is a referendum supplement. It is not part of your base salary. It is part of your FRS. It is added on. And thank you to the voters. And I know thank you to the voters for continuing to every 4 years have confidence in all of us to do a great job for them. And as we have an aging community for people who don't even have children in the system, who say, you know what, that's still the right thing to do, because I believe in public education. I believe in taking care of people the best we can. We would be significantly further behind in terms of trying to figure out what to do with salaries if there wasn't that supplement that does come in. To Tracy's point of adding it to the sheet, we're not adding it to the sheet to negotiate the dollar amount that you're going to get. That's going to happen through referendum. That's not the case. We added to the sheet for full transparency. If the request is to remove referendum from that and only come in and just talk about general operating dollars, we can gladly do that. We like to lay all our cards on the table. We've done that. I've only been at this twice, but both last year and this year, we said, this is what we can get out of operating. This is what we have moving forward as a continuation of ref. As you recall, last year when it went from a half mil to a full mil, it was a $4,000 extra supplement for each of you. And so we add that in there intentionally so that you see it, because if I'm you, I want to know how much referendums coming through. And of course, this year we added in the TSIA as well, because there's specific provisions, and I know every one of you read the House bill and gone through it, know the rules behind that too. So we'll speak a little bit to that today too. So as it relates to a counter to your counter, as we left here last time, we said, I think this was you, and if I misspoke or misheard, please help me. I was going to do my best to bring to you a better update in terms of what our calculation strategy was for TSIA, to get an update as it relates to referendum, and to bring that back to you today. And the evening that you emailed me, I said, I don't know if I'm going to be able to pull that together. I got to thank this team because they did. And I believe you sent no shortage of maybe a handful of different requests, each of which I'm pretty certain I accommodated for you as quickly as I can, sometimes in the wee hours of the morning when every single one of you should be sleeping, not responding to emails, by the way. That's a bad strategy, okay? But I think it's important to do that. You've asked for stuff, and I give it as fast as I can. One of the things that we wanted to do last time was to speak in absolutes as it relates to TSIA and who qualifies for that and who does not. And I will tell you, Pinellas County Schools is going to take the broader definition to include as many people that are the 10-year plus in that category as possible that fall under classroom teacher. So some of the things that we've investigated, Tracy, and I'll push out some numbers for you in a minute here, were around, do we have to exclude Title I funded positions? Well, that's not part of the FEFP. So a lawyer could look at it one way and say, those aren't funded through FEFP, those are funded through grants. And so our stance on that was, no, we're going to include those people if they're full-time classroom teachers. And the reason why is our view is those folks are servicing FEFP children. We're funded through FEFP based on the number of children. So that's the lane we're taking to make sure we include as many of those as possible. Ones that we cannot include, we're not going to violate the law. That's not going to happen. And as the law gets further defined, if they define it differently and turn our attention, we're going to stop, recalibrate. But if you are a person who's not a full-time classroom teacher, not in one of those categories, I sent every single one of them to Tracy. I'm sure she can relay that to you as well, line by line of which job codes qualify. Well, we can't include adult ed. We can't include PTC. That's not part of FEFP, which funds K-12. So there will, unfortunately, be some folks in our district that are 10-year or more that will not qualify for TSIA as defined by statute, as defined by our state. And that's the parameters they have. And we were told that every dollar of that money, unless you have an abundance of it, I say that with a smile, is going to go as they earmark to that group. And so we decided to break that off equally. We went back and recalibrated how many people, because we took a look at it first. We want to make sure we have the right dollar amount to start with. Understand the TSIA allocation that comes with us starts at 5-point-something mil and ends at 3-point-something mil. That doesn't go in my pocket. There's a huge part that has to go to FES scholarships, students first. That portion goes, and then there's a portion goes to charters, and that portion goes. We don't get to decide how the charters divvy up their piece. We don't get to decide what the state pulls back for FES scholarships, but we can decide our portion of it too. So our decision to make that to all the teachers that are full-time classroom teachers of 10 more years is to divide that evenly amongst that group. And so Tracy, I'll tell you that number of the denominator of teachers, when you start really teasing it out, and not only did we look at it, there are categories where it's very obvious by the person's job title. That person clearly qualifies. Then we have some job titles, teacher other. Well, teacher other takes a minute, right? So we spent some time looking through it. Every single teacher other, what do they teach full time, or are they not teaching full time? Like instructional staff developer, or a psychologist, or a social worker, or someone else, right? Because there are categories that do not fit that. So the denominator for the number of teachers is down to, they qualify for TSA of 2,008. Wait, let me take that back. 2,733. Which is down from 2,835, so dropped a little over 100. And that's the same categories that I sent you, Tracy, a couple times. I don't know if it was last week or over the weekend as well. Last time we were here, we said the TSIA calculation was going to be a little over 1,000. It's going to be $1,083 for each of those 2,835 teachers. When you drop the denominator to 22,733, the number goes to $1,124 per teacher that qualifies. I'm saying these out loud for some of you to write it down, or you can get the notes, because I've got a couple of handouts for the ones in front that can share with you afterwards. So that's the first thing we did, is recalculate TSIA. Then we went back and took the referendum supplement that's going to come to teachers as well. The nice thing about the referendum, good, bad, or different, as we get smaller and property taxes go up, and I'm saying this for the group, I know you've heard this and you could say this as well, but for those that are new to the room, our property tax increase was 2%. That's great. We anticipate pulling in 2% more in property taxes that are coming into the full rep, right? Full mill. Well, with less people, you divide it out, it's a bigger portion. And so in this situation, it actually increases the supplement referendum for each person. So we calibrated it. We went back, recalculated as well, took a look at it. The total denominator of folks that we had looked at initially, when we were making our best estimate of where it was going to be, was a little over 6,000. And now that number is 5,695 teachers that would qualify for rep. 5,695. So that changes that proportionality as well. The proportionality of going in for the annual rep is an increase of $1,824 per employee, $1,824, for a total referendum funding per employee of $12,905. And so, yes, that will make its way to your pockets as well. And so it's pretty significant in that regard. From the standpoint of bringing back a counter to the 4.25 or 4.5, I think you said, Tracy. We know we don't have the funds for that right now. We said we would bring this back and watch how the healthcare goes. And so I'm going to push this to you today that shows those two updates. We did not update the 0.75% that right now we're pulling from operating to try to add on to what the supplement for the rep is and what the guarantee of the TSIA is from the state. I'll say one more thing about the TSIA, and this is a little bit tricky, and we're doing our best. And you can read all 100 and something pages of it yourself if you'd like, but I will tell you there's some vagueness to anything that happens with a House bill. And so here's the vagueness. Is it the first day of classes that we divide it up and see how many teachers there are? Is it the 10th day of classes that we divide it up and see how many teachers there are? Maybe it was yesterday. Maybe it was July 1st. I say that tongue in cheek, jokingly, but not really jokingly, because without a defined date, that's the date. This is what the state said. You will take that money, you will get it in the pocket of the teachers that qualify, and you will make sure it gets spent to them as you go through the first semester, but spread out over the course of the year. You will report to us the number of people, but they didn't tell us where our dipstick dates are. See where I'm going? We don't have a dipstick date. We did another dipstick last week when we recalibrated and looked. I can assure you that on the first day of school, the number of teachers I gave you was not going to be the same as it was today. It might go up a couple, it might go down a couple. We had 55 vacancies as of last Friday. We filled 5 today. 2 people resigned. It's going to change, right? And it will not be the same number of people that qualify even after the 10-day count. And I know you're familiar with a 10-day count, right? What happens at 10-day count? This school's way under enrolled and we got to move some people around. Maybe we move people around within the school, which is what some principals do sometimes. Maybe I thought I was going to have an instructional coach. I can't afford to have an instructional coach. I'm going to put that person back into a classroom and they just change buckets as well. So what we are going to do is we're going to use the same date stamp unless told otherwise by the state of September 1st to go back and take another look at it and divide it out. Why September 1st? Thank you for asking. I see the nodding. You were asking. We picked September 1st because that's the same date the state tells us to go back and recalculate teacher leave money. Different set of criteria, but it's a date that they've already established. So we said, you know what, we'll roll with September 1st. Do they tell us something different? We will adjust. We will not violate the law. So on that, I'm passing that back out. It summarizes what I explained. And then I'm going to give a little bit of a, Tracy, if it's okay, after you read that, I'll ask some questions, take some questions on that. And I want to give a bit about EWBS real quick for group 2, Tracy, if you mind, okay? So as the sheet you just have in front of you, the green is what I talked about, the updated numbers of TSIA. If you have the sheet before, you can see the difference between it. Those numbers were pulled as of the 13th, took us a little bit this past weekend, and we're going to run them again on September 1st. Remember that the money is going to get distributed after, not only is it a tentative agreement, but it's approved through the school board. And as soon as we can program it through an upcoming paycheck, so that should track right around it. We're going to make another, unless they can tell us differently, September 1st, the date we use. Annual rep, you can see the number there and the increase to significant when you have a lower denominator. That's one of the unfortunately good situations in terms of the people that are loyal and are here that are still with us is the referendum will continue to increase year over year as we get smaller and smaller. But something goes completely unpredictable with property taxes, which I can't predict. So don't ask me to solve that puzzle. So questions on what I just passed out, Tracy, and I just want to talk EWBS real briefly too, and let's see how else I can help.
Well, I think you can go ahead and talk about EWBS, and then did you look at any of the language that we presented?
And give me examples of that.
So like the bereavement leave and certifications.
As it relates to.
So they were, yes, like we,
right. So
we talked last time. You said that those were no's for right then.
Correct. I'll clarify for that too. So for those that weren't in the room in the very initial session, Tracy and the team brought 5 articles for us to take a look at. One is bereavement. Could we do this? One was certification. Could we continue that as well? There were several different things. Everything had a cost to it. Not all. Some of the things did not have a cost to it. This is not an open book year. We reviewed them. We did internally cost them out. I got back in the second meeting and said, at this time, we're not going to entertain opening up. It's got to be an agreement to open up an article outside of an open book year. So we opted not to. I did tell Tracy there were 2 that this group might be willing to look at if we can get a little closer to where we're at for salary. One could be bereavement, not necessarily the way it was written. And one could be the continuation of paying for teachers 5-year annual certificate renewal. 5 years you get, because that's something that we've done outside of the contract by adding into it. And that sunset on June 30th this past year. So we actually did that a year ago. We agreed to. It's something else we would entertain down the road. So maybe not today's meeting, depending on where we get to.
Well, and bereavement also sunset.
Yeah. Those are both 1 years. So I'm going to just give you a high level overview of EWBS. I think we've met it now
Twice.
There's a question.
Yeah. So no, we just had one other thing. So that, did you guys look at the terminal pay? Because terminal pay is also subject to bargaining since it involves money.
Yeah, we opted not to open the article. That was one of the articles you suggested.
That was one.
Yeah.
And then also was the sick leave buyback. And the reason why we are continuing to push on that is because we know how important it is for students to be in the classroom, but based on the fact, or not, of course, students to be in the classroom, right? But teachers to be in the classroom, to be teaching them, but based off of the district shrinking and then people working and then all of a sudden being non-renewed or positions being cut, then people are losing sick leave that they have banked. So we're hoping that this would be an opportunity, even if you didn't look at the language exactly the way that we had it, at the very least on the terminal pay, including people that have been not renewed to that
Sure.
option.
As we said before, we opted not to open up that article. That's still our stance right
Okay.
now. I did say potentially the bereavement. I did say potentially the certification. The cost out of some of those others aren't something that we were able to entertain at this time. And so the cost out for those are significant. So with that said, the answer is still no for those. And that's got to be an agreement to open up those articles. The other two, no for now, but if it's a situation where we get closer on where what we have to offer from our general operating and what you're requesting, and if one of those things is the type of thing, the bereavement and or the certification, then I'll gladly go back and make that recommendation back to our leadership and see if that's something we can bring forward. But today is a soft no for those two, harder no for the others.
Okay.
So EWBS has met, Shannon, how many times? Twice. And I said, that's a good group. It really is. That's all 4 associations too. There's representative from each of the unions there too, with our team. And I'm just going to not scream from the rooftops, but just make sure, go online and take a look at some of the meeting notice, minutes from EWBS. It impacts all of you. Take a look at your own healthcare plan. Take a look at it as well. We've been working numbers significantly for that. The next EWBS meeting is going to be at 3 p.m. on the 22nd over in our place, 3 p.m. on the 22nd, 2 days from today. We were asked at the time, so we brought a proposal. The first meeting was, this is the situation we're in, and we can no longer afford to be, I'll call it in the red versus in the black. When I say that, I mean in the black, that means you broke even or did better, and the red means you were at a deficit. And we started off EWBS very transparently like we did 1 year ago. And for those that haven't been in that room, I encourage you to join. It might be standing room only if you come. I only got so many chairs in that room. I know they'll live stream it, but you're more than welcome to come. We were 30 million short a year ago when we were sitting there. We knew it was going to be that short. We negotiate and get consensus as a subcommittee for EWBS a little bit differently than we negotiate for salaries with individual unions. There's 4 unions there as well. And our job is to get a consensus of any plan changes or rate changes that can hopefully get us to at least even. So in the year of 2025 was tracking, and we were sitting there a year ago starting EWBS, which we did much earlier. Maybe that was good, maybe that was not, I don't know. We typically start in the spring. This year we started a little bit later intentionally. The year 2025, the calendar year, Pinellas County Schools brings in money from premiums and spends money on everything. That's what self-insured means. I'm not trying to talk down to you, but I had to have somebody explain it to me a few times. So I hope that's in terms that we can all understand. We collect money and then we pay. So in the 2025 year, we overpaid by 30 million. That's 4.5% increase of every employee for a salary day. And so what do you do? I know this, if you didn't pay your mortgage month after month, you're not in your house very long. Maybe you are. You got a rich uncle that can help you. But I can tell you that 30 million in 2025. So we start projecting that in EWBS a year ago in the spring, knowing we're on track to be down about 30 million in 2025. And lo and behold, I think it was high 20s, but we were pretty close to that too. Give credit to the actuarials that said, based on your program and how much money you're pulling in, this is how short you'll be. And I'm not faulting anything. People get sick and we pay for it. That's what we do. So to everyone's credit, a year ago, we did some plan design changes. Some of them hurt a little bit because some folks had a change in their plan that they either didn't know what to do, weren't aware of, or maybe they had a deductible for the first time. About half our employees in Pinellas County never had a deductible because they were in a plan that never had one. No deductible. Across the country, deductibles are $1,800 to $2,000 per person. And if you don't believe me, look up private or any other affordable healthcare, take a peek at it or look at other plans. And so we, at the agreement of everybody, said we have to try to not be $30 million in the hole in 2026. And we did a great job. I think we got exactly where we thought we would land, because we went from 4 plans to 3 plans. We changed, we left rates pretty much the same. And then we made some plan changes. We got to add a deductible here. We're going to have to do something a little bit here. We're going to have to do a co-insurance here. So either change how much comes out of your paycheck, or we change the rules, which call the plan change. Plan changes are almost always around deductibles, maximum out of pocket, co-insurance, how do we do prescriptions, all the things, right? And so when we did plan changes and shrunk from 4 plans to 3, that change alone said, okay, now we'll track to be about 12 million behind in 2026. And guess what? This many months through, we're tracking 11.8 million behind in 2026. It feels a lot better than 30, but it's not in the black, is it, right? We can no longer afford to be self-insured. And I said this to the group before, and I'll say it again in all sincerity. We are not going to be able to be self-insured in 2028 if we continue to be in the red. $12 million is 2% salary increase for every single employee in the district, everybody. So what do? So when we're short and we give salary raises because they're dependent on each other, and it's coming out of general operating, well, that $30 million just came out of general operating that year. We had to eat it. And the 12 million we're going to be behind this year, we have to eat it. The state also requires us to have 25% reserve in healthcare. 25% reserve in healthcare. We have $0 in healthcare. Every month we fall behind. This gentleman, really nice guy, goes deeper into operating and is told, find the money because we're not going to pay for healthcare. This is what we've done for the last few years, month after month after month after month. And so when you fall behind and the state says you don't have any funds, he has to sign an attestation that says, I recognize we don't have 25% in reserve in healthcare. However, I'll find the money somewhere. I've got it. We also have the second lowest fund balance of any county in the state. Second lowest of all 67 counties. We don't have a lot of money in reserve. So he just takes it out of that, which is not healthy at all, considering things happen like storms and stuff. So with that said, we're tracking to be about 11.8 million behind. We did a proposal, we pushed it out, we met the first time. Thank you, your feedback is incredible. Everybody here, like, we don't have a better idea. If we did, we'd already come up with it. Because if I had an idea that said it's not going to cost anybody any more, by the way, it'll be cheaper, it would be fantastic. At what cost, right? Because the commitment is going to be that we're going to commit to being self-insured. We're going to figure something out for 2027. And we have plans right now. We literally just left the meeting talking about employee wellness clinics. And we want to move so fast to getting an RFP and bring employee wellness clinics in. They could potentially provide free healthcare for certain things for the employee that could really significantly cut our costs. Because we're not going to get out of this hole by charging more, although we have to charge more to break even right now. The end game is we have to cut costs. And that's something we're going to explore along with many other things that will be listed in the very first meeting as well. So we are committed to staying self-insured for 2027. We'll come up with something. We're going to meet on Wednesday. Tracy and her team had some fantastic suggestions. So we did some things that looked at deductible changes, looked at co-insurance changes for not all the plans, but some of the plans, looked for higher deductibles here. We did a little bit around plan change, and we did a little bit around rate change. We did rate changes that said, can we try to have the employee only be kept as harmless as possible, and the rate changes for somebody who was bringing people into the plan that weren't one of our employees, those were higher rates. That's what was our first proposal. And if you're a person with a full family on our plan, that's significant. That's scary, right? And there are people that are on our plan that maybe have a better option elsewhere. In which case, go find the best healthcare you can. But at the same time, that was our proposal. And we knew our proposal was not just to make 12 million up. It was 12 million plus the cost of increase. Healthcare goes up 10, 12, 15% every year. So we have to make up the difference. We're not going to be in the red in 2027, but we're going to be 11.8 million in the red in 2026. Almost guaranteed, unless everybody gets really healthy and no one goes to the doctor for the remainder of the last 4.5, 5 months of the year. And that would be fantastic. I wish nothing better than health for everybody. So why do I say that? Tracy and your team came back. Thank you very much, Shannon, as well. Said, could you take a look at lower deductible here? What if you didn't do that deductible? But what if you change rates there? I wrote it all down. We took it. We looked very carefully at the basic plan. We looked very carefully at the CDHP plan. But we offered other suggestions. Our SEIU friends, that's our kind of blue collar workers, they said they were going to have a suggestion that looked at the select plan. I've reached out twice, haven't got anything. I'm itching to hear it because if we can run some numbers, we will do so. And so we have numbers to run for you, and we're going to take a look at that and bring that to you on Wednesday. And we're going to bring the option that we had so you can see it all in one place. You're going to see the option that you asked for so you can see it all in one place. You're going to bring a third option that we're coming up with that you can see it all in one place. And I'll tell you the third option, the minute we started running with it, looking at it, was less painful in terms of the plan design change. A little less painful in terms of rates, but it's got to come at a cost elsewhere, right? It may cost in terms of salary doing something different there too. So the idea of stalling a little bit, waiting till after Wednesday to revisit salary, right on point. So that's where I'm at today.
Okay. Would it be okay if we caucus?
Absolutely.
All right.
You want us to leave? Yeah, we'll go to our little side room over here.
Perfect.
Thanks.
and we forgot to introduce, and we had all these people. So if you want to go ahead and introduce.
Our apologies for not introducing. We're going to start over here on this side. For those that don't know the group, over here is
Dina Collins, Human Resources.
Jared Jefferson, Chief Financial Officer.
Mike Bigucci, Human Resources Officer.
Evan James, Director of Payroll.
Arlen Spicer, Senior Compensation Analyst. Allison Hearn, Staff Attorney.
Dan Perazzo, PCTA. Brian Pickett, Vice President.
Tracy McConnell, President.
Janet Cunningham, PCTA Instructional and E-Board.
Shannon Hoff, PCTA Instructional.
All right, so we had a few questions that we wanted to ask for you guys and some things that we were thinking about. The first thing is that anything that is financial is subject to bargaining, correct?
Unless it's tied to an article, but it's not an open book. So her salary is an annual negotiation. That's what we're putting down for this time.
All right, and then my next question that I had is how much sick leave was left whenever people resigned or were non-renewed?
I don't know. Didn't bring that with me, and we didn't open up that one.
Is that something that can be costed out? Like what happens to the sick leave? Like, I know that there were people that left and they had sick leave, like they were non-renewed and they had banked sick leave. What happens to that money?
Further over here, about sits away.
Yeah, so it just stays on their record in case they ever do come back to Pinellas, or we do allow, or we don't allow, but if they have to transfer to another school district, if that district allows the transfer, they can transfer that time.
But what happens if they leave teaching altogether? Like, what happens to the money? So does it go to the general fund? Does it, like, what happens?
It's just time, it's not. Just a balance of the time that just stays on their record.
I would only add that the general fund would only be impacted if, while someone is employed, they use the sick. Then a portion of the funds that the employee receives are payroll funds.
Okay, so is there any way that we can tell how many people, like how much money was left from sick leave from this past year? So we know that, was there like 168? Yes.
It's not, it's just time that's on their record. We wouldn't be able to quantify the dollar amount because there is no
So
on
when-
basis of like how much percent they can get a year.
Well, it's like so confusing to me. So like, if somebody is sick and they miss a day, where does the money come from?
That part, that's their daily rate. But if we're not gonna pay that off if they don't retire. Then that's a whole different percentage. Maybe we could kind of estimate as if they had retired, I guess. How much that would have been worth, some kind of cost.
Yeah, could we get that?
I think it tied down to hours. I think it was
Yeah, we could, we know how many hours that somebody had when they left that didn't retire.
And there could have been employees that left that were in non-paid time and there was a cost to the district.
Yeah,
So it goes back and forth. So it's like Dave said, it's time allotted by hours, not necessarily the dollars, because just the opposite happens as well.
if somebody leaves the district, I'm asking because I really truly don't know. If somebody leaves the district and they were, like they had gone more than 10 days absent, right? Like they owed the district time and then they leave, do they have to pay back any sick leave or no? Okay,
Well,
Only if it's fronted to them, if they hadn't earned it.
if they use some of their 4-day advance. If they
Gotcha.
Year and they leave during the school year before they earn those 4 days, then we do take that back out of their last paycheck.
Right.
okay.
That happens. There's time left and that they truly earn it, that just stays on their record in case they return.
Okay.
If they request it to go to the
All right. And I do remember you telling me about if somebody is non-renewed and they were to go, like, for example, to Hillsborough, that they can transfer 1 day of bank time for every 1 day that they earn,
The
correct?
whole amount goes, but you only earn it at the same rate. You only get that day at the same rate that you earn it. So it's a 1-to-1.
Yes.
I would say we don't want to speak for the districts because
That's their.
there's.
Yeah.
Policies say if somebody can come in as they earn a day, they can bring a day.
Gotcha. And then. Go ahead.
I had a couple of questions. One was regarding the TSIA funds. I see that the cost of the fringe would be 3.7 million. When that fringe comes out, we reduce it by about 700,000 or so. My interpretation of the statute is that that entire amount should be going exclusively to salaries. And is there a common language definition for salary versus fringe? And that's my point of clarification. I don't know if we have any proviso, if we have any guidelines from the Department of Education as to whether that fund, the TSIA, is completely for salaries or whether or not fringe income.
Your interpretation is different than ours, in that we believe it includes it, and fringe and benefits are part of compensation. And so we're welcome to go back and scour through that, find that there's something legally that says it's different. That's not how we read it at all. So we have to accommodate for the fact that we're going to have to pay for fringe benefits or to go on with.
I do understand that.
Yeah.
I'm just in reading the language. I would ask, could you share the language that you interpret to be the case?
You're welcome to find a counter to what I just said.
Okay.
You can scour through it. It's beautiful bedtime reading. If you struggle with sleep at night, I encourage you to pull it up. It's a lengthy read, so you're more than likely, if you find something that challenges our thinking, I'll have legal review it, take it from there.
Okay. And my second question is regarding the non-recurring payment that was in your proposal from today.
Yes, sir.
I see that the amount per employee stayed the same, $106 per employee. But as we see that the total number of people in the bargaining unit has decreased. So why has that dollar amount decreased? In the previous proposal, it was $2.9 million. Now you're only proposing $2.8 million.
Right.
So you've removed about $138,000 off of the table.
We put it as an average salary increase of 0.75%. We put it at the percent, not a straight dollar amount. Average 0.75% came out to 406, and that's how we did the calculation. You're welcome. Questions, Tracy?
Yes, we have a couple more. On your soft nose from the district on reopening bereavement and reopening the pay for certifications for teachers.
Yeah.
When we cost out the total possible average pay that it could be for the certification for teachers, it's about $85,000. That would be your total number of teachers divided by 5, which is how often they have to renew their professional. And that's assuming that everyone does have a professional at that point in time. So it's probably an overestimate. I believe that we have that money sitting in supplements right now. As we looked at supplements and the lack of use of some of the flex supplements, I believe that could be covered by that money. Have you considered using that money that's an overage in supplements to cover that article?
No, because that's a different process altogether. The supplement committee that you sit on, that is not, we can't change the rules of the percents that go for supplement specific. We haven't added in certification. Certification is not a supplement. It's something we agreed to for years to continue to cover for the cost of the employee, which with a soft no, we may consider opening back on.
Correct. That my question wasn't changing a percentage. My question was to use the money that was not used last year. So the money that's in supplement should equal the amount that we have out there if everyone used all of the supplements. That didn't happen last year. So there is an overage in excess of $85,000. Would that be a consideration of using that money to cover that one article?
It is not.
Okay.
I have a question on the bereavement that we also had a soft no on. I believe that this has been asked and before, but the amount, we would like to see the amount the district pay for bereavement and how often, and I'm sorry, and then the total number of days, like the total number of people who used it or days that were used for bereavement.
We can get you that information.
Okay.
During the 25-26 year, because that was the.
Right, correct, yes, for last year.
Days, dollar.
Days and dollar amount, please, and thank you.
You're welcome.
And I also wanted to clarify, because earlier you said it, that we are allowed to live stream
Good point. I have two corrections to what I said earlier, one of which is we haven't live streamed the subcommittee at all.
Mhm.
Because you have 4 different unions and it's designed to be a subcommittee, it'd be more of a working group. This is far beyond a working group. Thank you for being a part of a listening portion of that as well. So that was one of the corrections I was gonna make. The other correction I was gonna make is the 25% for healthcare. It's actually 60 days out. So it's about 17% we're required to hold in healthcare. Considering healthcare was 150 something million last year, you can see we still have quite a little bit to put in. So the CFO was quick to correct on that as well. It's not 25%, it's 60 days, which is approximately 17% of the calendar year.
So are you saying we cannot live stream?
Correct.
Okay.
No. But. Maybe you're here today. Thank you.
So with that being the case, we gotta think about setting up our next meeting, and a couple of things is that I'm gonna ask if possible, whenever we do EWBS and whenever we do bargaining, would it be possible for us to have a larger room than the conference room?
I'll look at that. Okay.
Okay, because if we have this many people show, we're not gonna all fit in that room.
A little too tight.
It'll be really
So you guys
tight.
were friendly.
And the other thing that I just want to say is that we have to make sure that we set the date for bargaining within our time frame, but at the same time, I want to make sure that it's a time for us to really get into the weeds with the salary, because we need to know what's going on with healthcare before that. And the other thing, because of the stuff with the referendum, and I know the Pinellas County Schools is doing what is right with the referendum. I know that the voters, we've got Icy Rock that like oversee all of everything with the referendum to prevent the salary negotiations from just muddying the waters. I would like to have the annual referendum increase amount off of the sheet whenever we look at it. So that way we're just looking at the TSIA and what's coming from the district. That's not coming from the referendum, since we know that the referendum is not subject to bargaining anyway.
Understood. Yeah, we'll take it on. Thank you.
Thank you so much. So when would you like to meet?
So. Well, hang on. Bless you, whoever sneezed back there. I don't know, I think I said, but I can.
So, and whenever we come back, so whenever you presented this is pretty much exactly what you gave to us the last time. The only thing that was different was the number of employees that were covered.
With new calculations that I committed to saying at the last meeting, correct, that's exactly.
Okay.
what it is.
So-
I wanted to get that right. You remember last time it was a little bit messy about, well, title people and all these other people count. That's what we spent our time on. I said that wrong, but yes. We will bring, if needed, an updated proposal.
Yes.
So let's look at calendar. So I know you said you wanted some time in between. WBS is on Wednesday, the 22nd. We have the option of later in the afternoon on Thursday, the 23rd. That's one. And I'll flip to the next week if that's too soon for you. We can get the bereavement quickly, Shannon and group. I think we could probably get that to you tomorrow. I'll get the people. So that you have time to process that prior to coming back, okay? And then, so I would suggest Thursday, the 23rd, that's one. We can get into the next week. Seeing some nodding.
I just can't be there.
Same thing. So then, you do it Thursday. All right, so the 23rd.
And can I suggest 4:30? I don't know what time your work days. Seems to be, we've got a good crowd here on 4:30 today, so
4:30.
what I hear is 4:30 to 5:30. We'll come to you if you'd like, unless you want us to find a bigger venue in the building, I'll do that as well. We can alternate back and forth for your purpose.
I think we're gonna have to do over there because we got the new teacher flea market that's coming in here. So unless you want to sit on some boxes of stuff.
I saw a box labeled Fort County, you guys are giving stuff away. We'll do it in our place as well. I'll see if I can get a larger space, that shouldn't be an issue. I know a guy who's the building administrator, so we should be able to.
All right. And maybe we should make it go a little later because we may have to get messy.
Yeah,
Get in the weeds, baby.
So can I just say, thank you all. I said on the front end too, if you didn't hear me in the back, I'm sorry, I don't have a microphone, but I can speak pretty loudly. Thank you all for being here. We hope to see you on Thursday at 4:30. We'll find a venue. I'm gonna make sure I get that over to Tracy as soon as I can as well. And hopefully we can get this resolved as soon as possible.
Perfect.
Do you have any other data questions to the beginner?
I don't know. I think about things all the time.
I know.
You did write down the hours. Yes, thank you.
We won't take it out by person, because it's down to $1 per person.
Yeah.
So probably 2 numbers, right?
Throwing that out there.
Or maybe 3, like, it's, let's say it's 4 hours. Hours. Thanks, guys.